Today we're going to talk about natural remedies for polymyalgia rheumatica, or PMR. What works, what doesn't, and the big unknowns that are out there. So I'm Dr. Megan, the Prednisone Pharmacist. And first we're going to talk about what is PMR, what are the normal treatments, and then we'll get into some ways you can test for PMR and to help minimize the side effects, and maybe some possible natural remedies. So here we go. First, let's define PMR. Polymyalgia rheumatica is a chronic inflammatory disorder where there's pain and stiffness in the shoulders, sometimes the hip, the back, and other large joints where it's really muscle joint pain and it's hard to lift a cup. Just using the shoulders is incredibly painful, and people are often completely debilitated and reliant on others for help without treatment. Who does it affect? It affects people over the age of 50, and women are 2 to 3 times more likely to develop it than men. It often comes on suddenly. One day you're fine, and the next day you have this horrific morning stiffness, flu-like symptoms, even weight loss, or low-grade fevers. Unlike rheumatoid arthritis and other rheumatological diseases, PMR doesn't cause weakness or joint damage per se. It can make everyday tasks like brushing your hair, brushing your teeth, getting dressed painful and frustrating. And in some cases, PMR is linked or has a higher risk for GCA or giant cell arteritis, which can lead to blindness, vision changes, and artery problems. The exact cause of PMR isn't fully understood, but most doctors believe it is an autoimmune problem, meaning that your immune system mistakenly attacks itself, your own healthy tissues. Genetics, infections, and even imbalances in gut health could all play a role. For example, studies have linked PMR to inflammation caused by gut dysbiosis or an imbalance in the gut microbiome. Interestingly, PMR seems to flare up seasonally, which makes researchers think that environmental triggers like viruses may also contribute. Now let's talk about how PMR is conventionally treated. Conventional medicine focuses on the inflammation and managing that inflammation and pain with low doses of corticosteroids like prednisone. Most patients start out with about 25 to 12.5 milligrams of prednisone a day, with gradual tapering to the lowest effective dose. Most people stay on that for at least a year, if not 2, or even 5 years. And while prednisone can work very effectively for PMR, it comes with a host of terrible side effects that I've personally experienced, like weight gain, insomnia, mood changes, diabetes, heart disease, bone loss, and so many more. Doctors may monitor your PMR with blood tests like CRP, or C-reactive protein, and ESR, or erythrocyte sedimentation rate. These show how much inflammation there is in your blood. Here's where things get exciting. There are other things that you can do to manage your PMR. There are ways to address inflammation and improve your quality of life. So let's break it down into 4 key areas: diet, supplements, physical activity, and stress management. First, anti-inflammatory diets. Diet plays a huge role in managing inflammation. An anti-inflammatory diet, like the Mediterranean diet, is packed with fruits, vegetables, whole grains, olive oil, and fatty fish like salmon. These foods help lower inflammatory markers like interleukin-6 or IL-6, which are often elevated in PMR. And if you have food sensitivities, eliminating those trigger foods can also reduce inflammation. There are some PMR support groups who advocate for a keto diet as a way to minimize inflammation. And that means basically going off all forms of carbohydrates, minimizing the amount of carbs, and maximizing protein and fat. The problem is there isn't good research showing us what the best diet is for PMR just yet. All right, what about supplements for PMR? Can I just take a supplement and then I won't have to take prednisone? That would be a dream come true. And I'm not aware of anything that can do that. As far as I know, prednisone is the go-to treatment. There's another injectable biological medication you could use, you can talk to your doctor about. But as far as supplements, nothing is a slam dunk. But here are some that people have used, and I'm just going to name them. There's no good evidence in PMR, but here are some possibilities you could try. omega-3 fatty acids like fish oil. These reduce inflammation and chronic pain in other diseases. Curcumin or turmeric. Curcumin is the active ingredient in turmeric, and it has powerful anti-inflammatory properties. If you pair it with black pepper, that boosts absorption. Then there's MSM or methylsulfonomethane, and then devil's claw and boswellia or frankincense. Frankincense can block inflammatory pathways and reduce pain. And then rosehip is known for its antioxidant and anti-inflammatory benefits. Again, I'm not aware of any research proving any of these help in PMR. And you need to be aware that several of them have a drug interaction with prednisone. So if you are taking prednisone, you definitely would want to avoid turmeric, boswellia, and devil's claw. But there are some supplements every single person with PMR or not PMR who's taking prednisone should be using. And that includes calcium and vitamin D. These are recommended by the guideline written by rheumatologists called the Glucocorticoid-Induced Osteoporosis Guideline. And they recommend calcium and vitamin D at a minimum to prevent bone loss. So if it were me and I had PMR, I would for sure do omega-3s, calcium, and vitamin D. And that would be, I think, a baseline for what you need to support your body. Now let's move on to physical activity. So gentle exercise is really important in PMR, and it's a hard thing to motivate yourself to want to move when your body has so much pain. But if you have the prednisone on board, it should minimize that pain so that you can move. I know several people who have PMR and are previous Ironman athletes. And while they don't immediately go back to an Ironman, they do stay active. And so I don't recommend incredible athletic pursuits like that. I do recommend exercise, especially walking, yoga, tai chi, swimming, like hydrotherapy, water aerobics, things like that are really important. They can loosen stiff muscles, improve your circulation, and even reduce pain. In a survey of 197 people in the UK, it says many non-pharmacological therapies were perceived to be helpful, with most participants reporting change in exercise at 85%, massage at 86%, and hydrotherapy at 81%. So those are some things you could try. That brings me to number 4, which is stress management. Chronic stress can make inflammation worse. So finding ways to relax is crucial. Practices like meditation, deep breathing, and possibly acupuncture can help balance your immune system and reduce pain. Acupuncture has better evidence in other diseases. There's not a lot of research in PMR. And in other rheumatic conditions, it has evidence for reducing symptoms by regulating inflammation and promoting healing. So what are some other tests you can do? I've already mentioned ESR and CRP, but if your trigger into getting PMR was gut dysbiosis, you could do a functional medicine test to check your gut. And then make sure when you're being diagnosed with PMR that your rheumatologist did a full battery of tests to make sure you don't have autoantibodies that could lead to a diagnosis of lupus or rheumatoid arthritis. Because PMR is really a diagnosis of exclusion. It's making sure you don't have these other diseases, and then you can say it's PMR. So make sure that those are ruled out, that you don't really have lupus or rheumatoid arthritis or some other issue, that it truly is PMR, that you're really getting the proper treatment. So what can you do to feel better? Let's recap. Adopt an anti-inflammatory diet. Basically, stop eating the standard American diet. No candy, junk food, eat real food. Whether it's the Mediterranean diet or the keto diet, make sure you're incorporating actual food and not food that was manufactured in the last 50 years that looks like food, makes your body think you're eating food but isn't really food. Second, incorporate supplements like omega-3s, calcium, and vitamin D. Number 3, stay active with gentle exercises like walking to loosen your stiffness. Number 4, explore stress management techniques like meditation and yoga. And number 5, talk to your doctor about identifying root causes to make sure it's not something else, and that if there is a root cause, it's being treated. And if you want the best supplement that many people who have PMR rely on, it's called Nutrinize Zone. I invented it to help support people on prednisone. It has a morning and a bedtime bottle with everything you need to support the needs of people on prednisone. Things like calcium and vitamin D and other supplement ingredients to help with bones, others to help with your mood, to help you get restful sleep, even more ingredients that help with your metabolism so you can minimize the blood sugar changes, weight gain, and moon face. So you can just get this at nutrinize.com or on amazon.com to support you while you're on prednisone. You can check out, there are many reviews from people with PMR who found this the most helpful supplement while on prednisone for PMR. Signing off as Dr. Megan, your prednisone pharmacist.